What if you have a patient that you're working with that is having some elbow pain, this lateral epicondylitis or tennis elbow out here? What are some things that you can do that's really simple? You don't have a lot of time to spend and maybe you have limited supplies. So what can you do to try to reduce this pain that the patient's having so they can continue on with their program? We're going to prop this up and go into wrist extension. So I'm just going to show you that. I'm going into wrist extension and I'm going to try to hold that and then slowly lower that down. All right? Maybe you even have to help the patient bring their wrist back. They're going to hold that, slowly lower that down. They should feel that out here on this extensor mass on the outside portion of the elbow. The next we're going to do is wrist flexion. So you're going to flip over this way and they're just going to pull the dumbbell back in this direction. This one should be a little bit easier for the patient because we're working the wrist flexors on this side and the wrist extensors on the back side where the pain is originating from, those have to elongate. So I almost use this more than a strengthening strategy, almost like a stretch, right? Because if I'm contracting these muscles on this side, the muscles on the opposite side, there's those antagonists, those have to relax. So those muscles are going to relax a little bit, so I'm going to get a little stretch just like that. You can use a small band, you can use a bigger piece of exercise band or exercise tubing. What I'm going to do with this is I'm going to put it around all my fingers, just like this, and then I'm working on extending them and opening them up. So I'm doing this between 1 to 2 sets, maybe even working up to 2 to 3 sets of 10 to 12 repetitions. Hand strengthening or grip strengthening, there's all kinds of these that you can use. I don't really care what kind you use, so you just really focus on contracting the muscles there. You're going to feel that in the forearm again on this side. 2 to 3 sets of 10 to 15 repetitions using a scraping tool. Now, we have to be careful because a lot of times patients, if they have skin integrity issues, you would not use this. Maybe they have vein issues or they have dialysis ports, all these different things. So you have to be very considerate of that and be careful, and in those cases not use one of these. Just use your thumb or your finger and you just go right over that area that's irritated, and you're going to do a little what's called cross fiber friction massage, or you can go all different directions. I don't really have a preference with that. Again, for me it's just more, it just feels good to have pressure and have it pushed on. The last thing we're going to do is stretches. So you're just going to bring the wrist down and stretch just like this. You're going to feel that stretch all the way down there. You can even have the patient curl their fingers around and kind of make a fist and go down and stretch, and you're going to feel a nice stretch there. And I hold that somewhere between 10 to 20 seconds. You can do those stretches before all of your exercises or afterwards. It doesn't really matter to me, or even throughout, whatever works the best for the patient. I hope this video helps guys to try to reduce some of that outside or lateral elbow pain that your patient's having so you can continue on with their functional program. Thanks for watching.